Electric shock can be lethal due to its ability to disrupt the normal functioning of the human body. The severity of the injury and the potential for fatality depend on various factors such as the magnitude of the electric current, the duration of exposure, the pathway of the current through the body, and individual factors like overall health and resistance to electricity. When a person comes into contact with an electrical source, the current can pass through their body, causing three main types of injuries. Electric burns. When the electric current passes through the body, it can generate heat and cause burns at the points of contact with the skin. These burns can vary in severity depending on the intensity and duration of the current flow. Internal injuries. Electric shock can also cause internal injuries, particularly when the current passes through vital organs such as the heart, brain, or lungs. The electric current can disrupt the normal electrical signals in these organs, leading to irregular heart rhythms, arrhythmias, seizures, or difficulty breathing. These disruptions can be life-threatening. Muscular effects. Electrical currents can also affect the muscles in the body. Strong currents can cause muscles to contract forcefully, potentially leading to fractures, dislocations, or spinal injuries. If the muscles involved include those necessary for breathing, it can result in respiratory failure and asphyxiation. Furthermore, electric shock can also lead to secondary injuries. For example, if the shock causes a loss of muscle control, the person may fall and sustain additional injuries from the fall. In some cases, electric shock can cause cardiac arrest, where the heart stops pumping blood effectively. If immediate medical intervention, such as cardiopulmonary resuscitation, CPR, or defibrillation, is not provided, it can result in death. It's important to note that the effects of electric shock can vary widely depending on the circumstances. Even low-voltage currents can be lethal under certain conditions, while high-voltage shocks may not always be fatal if immediate medical attention is provided. Regardless, any electric shock should be taken seriously, and emergency medical services should be contacted immediately.